So, hi everyone, welcome to this webinar all about GP Connect and CareLineLive. I'm Marie Page, I'm the Marketing Manager at CareLineLive. I'm joined today by Alison Taylor from NHS England, Sean Orrell, who's our Product Manager, and Dec Norton, who is our Development Director. Nick Shaw, our Head of Operations, is also around in the wings. A few things, admin things I just need to tell you about. You will get a copy of this emailed to you. It probably won't be today. It takes a while for Teams to kind of render this and make it available, but it will come through to you as a recording, and we will also make the slide deck available. If you have any questions, please put them in the chat thread and we will pick them up at the end, and there is plenty of time for Q&A at the end. We've also got an FAQ section that Sean and Dec will be running through with you at the end. So quite a lot of your questions, hopefully, will be covered. Okay, so let's just go to the first slide, who I think Sean is managing this. So this is our rough agenda. I think the times are all going to go completely way out, but we should be easily finished within the hour. So we'll start by, Alison will talk to us about what GP Connect is and look at the benefits of it and the wider project from NHS England. Dec will then talk about the National Data Sharing Agreement and activation process. He'll also talk to you about how GP Connect and CareLineLive work together and give you a quick start guide. Sean is then going to do a demonstration of how it all works within CareLineLive. He'll then host the Q&A session and we will then finish. So I'm going to hand over to Alison, if that's okay, and I'm going to put myself on mute so I can answer these questions that are popping up. Thanks very much.
Marie, we've just had there's a couple of comments that people can't hear.
Yeah, it's probably, given that we can all hear, it'll probably be their settings.
Nick, maybe you could log out and log in, maybe that sometimes sorts the hearing issues out for you.
Yeah, it'll be their own settings. I'll tackle that in the chat. Thank you very much, Alice. No, just over to you now.
Thanks, brilliant. Thanks, Marie. Thanks for inviting me, and hello to everybody that's on the call. Great to see so many people joined. My name's Alison Taylor. I'm currently the Senior Programme Manager sitting within the Digitising Social Care Programme under NHS England and Department of Health and Social Care. Please, if I use acronyms, drop them in the comment and ask what they are, because I might forget as I'm talking. We do use a lot of acronyms, and I've been around on this project a long while, so I'm here to support you guys in this GP Connect. Not sure who I'm talking to or the level of information, but GP Connect is just basically a level of information that we're now sharing with social care staff that comes out of the GP record, and it will enable you to stop phoning for several reasons that you do every day in your life for users. So it's for all CQC registered care providers, you being one of them, to access the restricted view of the person's record. And to do this, you must have a digital social care record, which you've all got. You're working with CareLineLive on the call, and you must have reached the standards met on the DSPT, which stands for the Data Security Protection Toolkit. If we can have the next slide, please. I've been working on this project probably for about 4 years now, from when I came from primary care. I am a nurse, so I know how I am passionate about getting information out to everybody that needs it and making our life a little bit easier. So from that slide, you can see the roles for a role-based access control, that you're able to see this information, which later on in this webinar you're going to be shown that through the other colleagues that are on the call. Since March 22, we had 3 suppliers that were assured with GP Connect, and as of this April, we've got 5, and as of last week, we've got 8 that have been assured, but currently only 4 live, because there's lots of work to do that CareLineLive have been through the process to get you guys on board and share this information. So it's quite an exciting place to be. On that slide, it will tell you what you can get, the information, but there's nothing like seeing it, so I'm going to let that demo that I think they said Dec or Sean's going to give, can't remember, so apologies, later on, which will actually show you what you can see rather than it just be a slide in front of you. The next page, please. I think is benefits. I probably don't need to speak to you guys about how important it is to get you the right information at the right time for the right person to give better care. And this just outlines a very high level slide from people all the way up to the system benefits and why we all want to do this. So that's just a visual thing for you guys to take away, and I'm sure there's nothing new there that you all know about working in this sector. Next slide, please. So from peer to peer, these are what people have implemented nationally. We've now got around 2,000 sites that are live with GP Connect, and there's nothing negative that's come back. It's been a real transformational program and quite trailblazing to get this information out there with you guys to realise these benefits, and they're just some of the testimonials over the last year or so that I've been getting back from people. So I just put it in a slide deck because it's the good stuff. It's what really makes sense to you guys and why we're doing this. And I think finally from me is just the numbers over a period of time. So for the last couple of years, I've been working with various suppliers to implement this to care providers, and you can see visually there that we've made a steady progression upwards over the last couple of years and hope to have a real big trajectory in the last 6 months, the next 6 months, with all the suppliers that are coming and being assured, CareLineLive being one of them. And I think that's it from me, if I remember rightly. Brilliant. Happy to take questions now in the end whenever you're doing it, or I'm handing over to Dec.
Yeah, we'll do questions at the end. So Dec, if you could take over now, please.
Yeah, brilliant. Thank you. So yeah, my name's Dec. I'm the Director of Development at CareLineLive, which means I've had my head in all the technical GP Connect implementation stuff over the last few months. So yeah, first of all, we just want to explain a little bit about what the process is going to be for actually getting you onboarded to GP Connect, so you can actually start using it within your CareLineLive environment. I am going to be speaking as if you're an existing CareLineLive customer. I appreciate that there's some new, well, not new, but potential parties that could be interested on the call as well. So to start with, we'll cover what the NDSA is. So the NDSA stands for National Data Sharing Agreement. So this is an agreement that you will be required to sign with NHS England, which covers all the data sharing requirements which are required for GP Connect. GP Connect can only be used for direct patient care, so bear that in mind. And the NDSA itself is a signed kind of agreement stipulating that you are going to fall within the bounds of the data sharing agreement. And it must be signed before you can begin onboarding with us. Next slide, please. So first of all, when you're signing the NDSA, you'll be asked to select your GP Connect system supplier. So that'd be us if you're going with us. You'll be asked to enter the ODS code of the location that you are going to be registering. So if you're an organisation that has multiple sites or locations, you will need to sign the NDSA for each location that you want to implement GP Connect in. You'll need to state the reason that you're using GP Connect. So if you're a home care provider, it'd be home care, care home. And then you need to submit the signatory details of the person within your organisation who will be responsible for that agreement. So it could be your caldecott guardian, data protection officer, or registered manager. Next slide, please. So in order to get activated with GP Connect and CareLineLive, first of all, you need to be a CQC registered organisation. So that's NHS England or England and Wales only. You must have a current standards met digital security and protection toolkit self-assessment. Hopefully most of you are aware of what that entails now and have a current assessment. You must have signed the agreement, and going forward you must make sure that you adhere to all the data protection laws and you are only using GP Connect for the purposes of direct care. Next slide, please. So next, just going to give you a quick kind of overview of what the process will look like when working with us. So first of all, you'll need to register your interest with us. Let us know that you're planning to implement it. You need to make sure that you've completed the DSPT and NDSA steps. You can get in touch with us via the website. We will have a help article up shortly as well, and a tool integrated into the CareLineLive software itself where you can start that process nice and quickly. That will notify us that you are intending to start using GP Connect with CareLineLive, and we'll do some kind of back office activities to get you registered, which involves talking to the GP Connect operations team and getting some kind of unique credentials for you. If you have already used GP Connect with another system supplier, you won't be able to use the same credentials. We'll need to start the process again, so just bear that in mind. Next slide, please. So after that, you can then start preparing, getting ready to actually go live. You should start thinking about the list of users that you would like to have access to GP Connect. There are two different types of users. So firstly, and probably most common, is going to be restricted access. That will mean that you only have access to certain sections within the GP Connect record. So that includes, I was going to test my memory now, summary, medication, allergies and adverse reactions, and immunizations. So that can be used by anyone that's actively involved in the direct care of a patient. However, if you are a registered clinician and you have an active membership to one of the professional bodies, you can enter their registration details within CareLineLive, and they'll be able to access the full GP Connect record, of which you'll see more about later. You need to make sure that you've got the NHS number captured for all of your clients. That's how we kind of identify the client to NHS England and GP Connect. And lastly, you'll need to make sure that you have captured consent from each of your clients to make sure that they are aware that you will be viewing their GP Connect record through CareLineLive. We would suggest kind of making this a written document. You can then scan it in and upload it, and keep that as part of your audit trail. Then once we've successfully registered you with GP Connect, it can take a couple of weeks for the information to come back. Unfortunately, that bit's outside of our control. We'll be in touch to arrange a short onboarding session where we'll walk through actually configuring your CareLineLive environment. So it's kind of a one-step kind of setup. Then we'll show you how to record the consent for each service user or each client. We'll make sure that the connection is actually successful. And lastly, we'll just walk you through adding additional users onto your system as well. And if we go to the next slide, I've got a quick. Oh yeah, so sorry, yeah. Setting up your users. So as I explained, you've got full access and restricted users. Full access must be a clinician. Just make sure you're recording all the registration details within CareLineLive. For restricted, it could be any health or social care worker that is involved in the direct care of a service user. As mentioned earlier, you would only have access to the summary, allergies and adverse reactions, medications and immunizations, but you don't need to record any kind of professional identification for that. And then next, I've just got a quick little walkthrough of how you would add one of those users onto CareLineLive. So firstly, you'll notice a new section under integrations called NHS. And it's a fairly straightforward process. I'll let the video finish and then I'll talk about it a little bit more. Great, so yeah, new section under integrations for anything that's related to the NHS. We do have plans to add a couple more in the future, so expect to see more in there. Within that NHS section, there's a dedicated GP Connect section. For each environment, each CareLineLive environment, you can register multiple organisations. So going back to the requirements of the NDSA, each location or branch within your organisation would need to be registered separately, and we can support that through CareLineLive using Teams. So you'd register all of your organisations into CareLineLive and then assign users to each of those organisations. And all of this data is fed through to GP Connect, so there's a full audit history of who is viewing which sections of the GP Connect record and at what time. And with that, I think we'll move on to a bit of a demo of what GP Connect within CareLineLive will look like. So over to Sean.
Cool. Cheers, Dick. Hi, everyone. So yeah, we're going to go through what it looks like. I've only got one more slide before we actually see what it is, which is how does the GP Connect process work. So here's a very sort of simplified term, or a diagram of what actually happens. So CareLineLive does like the data collection and the visualization, but we need to have the inputs from the care professionals, which are you guys, whether you have the full access or the restricted access based on your availability. So we collect the client ID, the NHS number and the date of birth, and then we pass it through to GP Connect and request the data. If a record is found, then it is returned to us, and then you can view it within the CareLineLive platform. And if it's not found, then we provide you with a reason as to why that can't be found. But let's have a look and see what actually happens. So first and foremost, we spoke about the NHS number, which is here. What this video is talking you through is how to enter an NHS number into CareLineLive. A couple of things to make clear here. The first one is with the NHS number, we do have validation in line. So there's a specific criteria for an NHS number to be recognised as being a valid entry. We have all of that validation built within the platform, so you can't get it wrong by accident. Not saying you can't get it wrong in general, but accidentally, like if you get numbers wrong, there's sort of criteria placed to make sure that it's valid. And the second one is, if we just go through this again, is there's the identifier section at the bottom. So this identifier section was introduced in our last big update at the beginning of September when we introduced all the care planning functionality. So in the client profile, there's actually an identifier section in here. So if you just navigate to there, you'll be able to type in the information. So once the NHS number has been entered, we need to make sure that we've captured the choice of the individual client. So here is another new section within the client overview called choices. For the time being, it's only being used for GP Connect, but we have plans to include other sections within here in a later date with our upcoming developments. But the idea behind the choices section is to ensure that you have captured and, as Dick mentioned, evidence that we have permission or you have collected permission from the service user to access their GP Connect record. This is a critical part within the journey. If you don't do it, or if it's not captured, then you can't access the record. But it's not necessarily the client who always makes the decisions. Other people can make it, such as the next of kin or power of attorney. But just to make sure that everything is fine, then you have to go into client choices and make sure that this decision has been captured. And if you do want to do written permission, then you can upload that documentation in the document section as well. So GP Connect is another new tab. This literally just shows you where it is. Here's GP Connect, and this is what you can expect to see when you begin the process. It's a little bit simple in terms of just showing you a video of this, but I want to make sure that everybody has a clear understanding of what happens and what to look for as and when you come on board. So here you click on GP Connect, you can choose the organization of which you're using GP Connect from. Next, you click continue, and then what will happen is it returns the information. I'm just going to pause it there for now, if I can. There, it returns the information, and this is what GP Connect is actually going to look like. So let me just go back a little bit. Two things to make clear here. First and foremost is we are using test data from GP Connect. This is nobody's actual data, so there's nothing untoward here. It's just information provided on a test server, so we can show you this. And secondly, we're looking at this from a viewpoint of somebody who has full access, just so everybody can see what the full capability is for those people who are registered with the professional bodies. If you have restricted access, I can't remember what Deck mentioned now, like allergies and medications, but you'll have the restricted view, which means this panel on the left-hand side will just be reduced to the sections which only you can see. So just running through, you have the summary screen. So the summary screen literally provides everything within the records. The summary screen is also there for restricted access, but will only contain the restricted view. And at the bottom, there's two sort of time set stamps as well. Doesn't mean anything to you. It doesn't need to mean anything to you, but it's just to ensure that we show the information as and when it's been captured. So patient traces when you enter the search term, and loaded from GP connectors when it's returned to us. That's why there's two. Don't be confused or concerned that there are two individual timestamps. It's just what needs to be there to ensure that we are complying with what needs to happen. So that's the summary page. Moving on to encounters. This shows all of the encounters which the service user has. Again, this is all test data, so that's fine to show this information. The only difference here is for full access, you get everything. For restricted access, you only get the last 3 encounters, I believe. So here you can filter the information and stuff. If you do have that full access from different time frames, you can zoom in and see what's going on there. But yeah, this includes items like direct encounters, unplanned and indirect encounters, such as like viewing GP test results and out-of-hours clinics. But this information is available as and when it is requested. Moving on to clinical items. So this is only available for full access, and it's just to do with like relating to the care and well-being of the service user and like past medical history and that sort of stuff. But there's not many information on here, but if there is, they'll be populated within this section. Problems and issues, again, only for full access, and I know this won't apply to some people on this call, but it's here, and this is what you can expect to see. So this is any sort of disease or surgeries which the particular service user has, or any social issues such as like bereavements or unemployment. Anything which sort of formulates a health record will be published in here. Allergies, I think this is probably one which is going to be used quite a lot, because based on the feedback which I have got from speaking to customers, not having the full knowledge of an allergy is quite common practice because you just don't know about it. So with that information, this is all could be in here, and this will be available to everyone. Next up is medications. Again, I think this will be used quite a lot as well. So any sort of medications which are in here. So we're talking current and past medications, dosage instructions, discontinuation details, additional information such as linked problems and any medical issues or medication issues all come into here. So again, this is probably the most requested use case for GP Connect, I would say, in the research which we've performed in terms of understanding what medications happen, because they can change on a frequent basis in terms of like complicated care scenarios, and not having the full information is critical, or it can sort of have negative implications on the delivery of care to that particular service user. So having this information, not having to call the GP and wait in a queue for 20 minutes just to see if the medication has been updated, be able to access it directly. This I see as being one of the main benefits of introducing GP Connect into the CareLineLive and into your everyday processes. But enough applications, so on to referrals. This is a full access only scenario, so people with restricted access won't have this, but this is just details of any referrals from other services or departments relating to the particular service user. Observations are clinical observations recorded by health professionals. So this can happen during like any assessments which they have, sort of mental or physical. Everything is provided and put into this section. Immunizations, vaccinations, sort of self-explanatory, this one, any vaccinations or inoculations which they've had. But one thing to note as well is that this will also include declined vaccinations. I don't know what that is, but it will be there, which is good. And then I think this is the last one. Administrative items. This is full access section again, but any sort of tasks such as scheduling or administering encounters, communications organizations in terms of the delivery of care for the service user, and critical safety processes. Yeah, so that is all that GP Connect is. It's a very simple process from an end user perspective, because all of the heavy lifting and hard work has been done by DEC in the background. So integrating into the various NHS profiles. But for us as service users, I'm the product manager. I like shiny things and being able to simplify processes as much as possible so that we can get the information which we need to do the jobs which we do. It's a very simple process. You'll be able to capture this information. Two things coming into here is number one, this is read-only access. so we're not allowed to change anything. Whatever we see here is what is provided to us by the GP. We can't impact it, we can't override it or anything else like that. So if anything's incorrect, and that needs to be taken outside. And we can't change this banner at the top. So I know people love chucking change requests at me. It's like, oh, can we add this information? Can we change the color? Unfortunately not. This is all very prescribed by GP Connect. What we have here is what we have to do. Otherwise, we don't pass the litigation or to provide this information to you. So unfortunately, we're stuck with this, but it will provide you all the information which you need, hopefully, to deliver the service of care. This has been very quick sort of demonstration. So I will open the floor to questions. But what we have provided here is a quick list of FAQs, anticipated questions of what people may have. So I'm not really sure how questions process handles here. So I'll hand this back to Marie, and then Dec and I will answer as best as we can.
Thanks, Sean. If you look in the chat, that's where to see them. So we've got one question at the moment from Joanne Godsall. Are you able to see respect DNAR information and advanced statements?
Not at the moment, no. Well, I say not at the moment, it's not in the roadmap either. We do have those capabilities within CareLineLive. So we released the care planning module, I think it's beginning of September, where we do have the capability to capture advanced statements. DNAR has always been available within the medication tab within CareLineLive, but that's not something which we pull through via GP Connect.
Simone Dyer has asked, is it in the plans with GP Connect for the future that we can order medication for our service users? That might be one for Alison to answer.
I don't think it will be coming through GP Connect, but I think you will have a future of digital ordering. Because GP Connect isn't actually an ordering system, it's your emails and things like that that will do the ordering in the future.
Oh, thank you.
That's nice. That's nice.
Jeanette Phillips asks, this sounds amazing and should streamline operations in integrated health and social care. Absolutely, Jeanette. This is a huge amount of work that our dev team have put in to get this over the line, and they're very, very proud of what they've done, and it's great to now see it in practice.
Marie, there is one more question which I think Dec and or Sean will be able to answer quite easily from Win, and Win asked, what do you mean registered clinicians having full access? Does this include registered nurses who are CQC registered? That didn't quite make sense, but who are CQC registered manager, but I think you get the gist of the question there.
Yeah, so yeah, if you do have any employees in your organisation that do have they are nurses or midwives, for example, and have a clinical registration, then they would be able to see the full view. But if, for example, if you had a registered manager who doesn't have a nursing qualification or professional registration, they would still only be able to see the restricted view.
And there's a follow-up maybe on that for the restricted view. I think Rob is asking, why is it only 3 visits that would be seen? That could be a couple of days knowledge. So we will still have to pester to get the rest of the knowledge that we need. I'll let Dec, I think, answer that.
I'm going to pass to Alison.
Yeah, I was going to say, because that's how GP Connect has been set up, and we're really lucky to get that. This is the start of sharing information. So to get 3 encounters from a GP practice sharing with social care took me 2 years. So the future is obviously very different with structured information and getting better information across. But it was the best I could do at the time. So, you know, there's always more we can share, and that's what we need to work on in the future.
Thanks, Alison. I'm sure they will take feedback as well from providers. Claire asks Dec, when will this be available to CareLineLive users? I know you love answering questions like this.
Well, yeah, so we're ready to go now. So there is a form on the website. It's linked earlier in this presentation, which you'll get a copy of. But if you go to our website, which is CareLineLive.com, and then under our solution, there's a GP Connect form. If you submit that with your details, so your ODS code, and you've made sure that you've signed the NDSA, you've done the DSPT assessments, etc., then we can begin the process of onboarding you through CareLineLive. It will take anywhere from 2 to 4 weeks. those kind of lead times are outside of my control, I'm afraid. We have to pass the information to the GP Connect operations team and wait for them to register it with various systems in the background. And then eventually we'll get a unique identifier for you, which we can then use to set you up. So yeah, you can
that email, that's a URL that Deck just quoted, I've put into the chat, so you can go there and sign up to be one of our early adopters here. Adam Godsoul, when viewing the GP summary, does this have the function of saving to client documents area such as a PDF?
No, we are not allowed to do that, I'm afraid.
Okay. How long, this is Louise Cook, how long does your application to sign the NDSA take to be approved?
From experience so far, we've only had a handful of people that have signed the NDSA that we're aware of, and it seems to be a fairly instantaneous kind of thing. As soon as you signed it, then it's automatically approved.
And I just want to make clear, it's not our NDSA document. This is the NHS that you are signing up with, just to be clear.
Lovely to see so many of you keen to get moving with this nice and quickly. So now we're at the Care Show this week, quite a lot of us, including Deck, Sean, Nick and myself. So if you are at the Care Show and would like to come and have a longer chat with any of us about it, please do so. We will also be able to show those videos to you and, just show you how it's working within the system. So would be lovely to see you. It's always lovely to see customers at the Care Show anyway. Becky, sorry, not sure I've been asked. Is there a certain form for clients to sign for consent? Sean?
Not a form as such. There is, you need to get permission from the client to ascertain that they are happy for you to use their details to access a GP Connect record. That comes in a new module within the platform under the client overview called Choices. I can't remember which video it is now, so I'm not going to go back and try and find it. But it's there somewhere. Go back in the video when you look at it on catch up and you can see it. But yeah, they have the ability for you to collect that permission. That does need to be collected before you access their records. So yes.
So the cost. So there's no additional fee for GP Connect. CareLineLive's pricing is very transparent. We charge a single amount per carer per month. There's a minimum spend of £100 per organisation a month. So there's no additional cost to access this. You are just needing to pay the per month price for CareLineLive. We can talk to you about give you a price for your organisation if we take a demo with you. We do also have a pricing page on the website, which you are welcome to look at. Louise, who do we contact when we've met all the criteria to join, or is it just the support email address? Deck?
Yeah, I mean, yes, so you could contact the support team and they'd forward your details on to us. Otherwise, yeah, that page on the website, which I've mentioned and is linked in this presentation, we'll be sure to share a link to it to everyone that's attended today as well. It's a very simple form, just ask for your name, organisation details and your ODS code, and yeah, we can kickstart the process.
So for Phil Eckersley, if you could fill the form in online, we can get moving with you on that. Joanne, just to clarify, we have a share and consent form that is signed by a client representative during assessment. I know you mentioned getting written consent, which we already have. Do we have to populate the client choices as well to gain access?
You do, yes. So client choices is very simple form, is a checkbox. It just means that you have ensured that you have consent from that service user, whether it's through a transparency notice or a general agreement that you make everyone sign, or you want to go and sign a specific document which grants a consent. But we do need to make sure that that is recorded within the client section before we give you access. How you go about making sure that you have consent, in a way, it's none of our business, but we just need to make sure that we're covering that element of it.
Thanks, Deck. So Rob, where is the sign up form on CareLineLive? Can't find it. Good point. So that link that I gave you, it actually says how to start using GP Connect, and there's two ways. If you are currently a customer, we are suggesting that you get in contact with customer support and and that's your sort of trigger point. If you're not a customer, you need to come and have a demo with us first. Nick, if you want us to put a form on, we can do that this afternoon. But if you're happy at going via the support team, we can do it via that.
Sorry, I thought it was already there. I'll hold my hands.
No. Are you happy at going via support, Deck, or would you like a form put in?
No, absolutely, yeah.
Absolutely, yes to what?
No, yeah, go via support. If you've got our email, email it somewhere to us, and we'll
if you use the contact button on the website, that's fine. Thank you. Simone, we've used CareLineLive for a couple of years now and been quite happy. Unfortunately, GP Connect won't work for us really, as we have no nurses as clinicians, and so wouldn't see what we need. But I would certainly recommend CareLineLive as a system. Blips at times, as with every system, but great team. Thank you very much. We do appreciate that, Simone. Simone, if you'd like to do us a Trustpilot review about that, we would be even happier. I'm sorry you can't use GP Connect. That's
Marie,
such a shame.
I'd be interested to see what the why and what you need then for non-clinical people.
Yeah, so for non-clinicians, for the restricted view, you would still have access to all the current and past medication. You get access to, allergies and adverse reactions, immunisations. So yeah, I'd still encourage you to give it a go if you can within your organisation.
Yeah, Simone, I'll reach out to you. I'll find your details somewhere, probably from Nick, and then we'll have a chat, and then we can try and see what you need and if there's a workaround around it.
Sounds good. Thank you. I've just put a link to the Trustpilot review as well. We really, really love having those. Thank you, everyone. Are there any other questions? Obviously, as you start the process, if there are other questions that come up, you'll be handheld every step of the way. Yes, Carol, we can do a Zoom with you for a demo and everything. I will get Sylvia or Jess to give you a call, and if you can drop us a message with your number on, I've got an email address but probably not a number, we can get that set up for you. So hopefully we'll see some of you at the Care Show this week. That's Wednesday and Thursday. And we'll be putting some bits and pieces on social media, so feel free to ask us some questions on there. We will come back to you as well. But if there's no further questions, I will say thank you very much to Alison for her time and support, hand-holding us through all of this process. And thanks to Dec and Sean for putting the presentation together. As I said, we will have this whole webinar will come out to you, and we'll put it up on our YouTube channel as well. And we'll send you the slide notes too, but that will be probably a day or two. Thank you very much, William. Appreciate that feedback.
Thanks, everyone. Bye.
Bye.
Thanks, everyone.